Your skin drinks it like it's desperate. So apparently slathering yourself in thick, weird-smelling bean oil before bed is a health move now. Cool. But here's the thing. Your skin genuinely doesn't care how strange it looks on your nightstand. Castor oil is packed with something called ricinoleic acid, a fatty acid making up about 90% of the oil. Your skin has tiny openings called pores, and ricinoleic acid molecules are small enough to slide right through them into the deeper layers, not just sit on top like most moisturizers do. Once inside, it signals your skin to produce more of its own natural oils, called sebum. Dryness doesn't stand a chance. It also triggers aquaporin channels, little water doorways inside skin cells, to move hydration around more efficiently. By morning, your skin barrier, the outer wall that keeps moisture in and irritants out, is noticeably stronger. Scientists call this transepidermal water loss reduction. You can call it, "Why does my face look like that?" Your lymph nodes throw a detox party. Your lymphatic system is the one organ system medical school barely covers, and your doctor never mentions, until it fails spectacularly and you're Googling neck lumps at 2 a.m. in a panic spiral. Congrats, you've been ignoring your body's entire sewage treatment plant your whole life. Applying castor oil, especially as an abdominal pack before bed, gets this sluggish system moving. Ricinoleic acid activates prostaglandin receptors embedded in lymph vessel walls. When those receptors fire, the vessels contract more rhythmically, pushing fluid through lymph nodes faster and more efficiently. Unlike your cardiovascular system, lymph has no dedicated pump, no heart. It relies entirely on muscle movement, breathing, and chemical signals to keep flowing. Ricinoleic acid essentially donates a motor to a system that normally just coasts along hoping for the best. While your body runs its deepest repair cycles, lymph nodes filter waste more aggressively. Immune cells, which travel through lymph fluid, get repositioned faster. You wake up less puffy, less foggy, and with an immune system that actually showed up to work. All because you rubbed bean oil on yourself before bed like a completely normal person. Joint inflammation gets body slammed. Congratulations on having knees that sound like someone stepping on bubble wrap every morning. That's not just age, that's inflammation slowly remodeling your cartilage into something resembling gravel, one painful night at a time. Ricinoleic acid is a natural COX-2 inhibitor. COX-2 is the enzyme your body uses to manufacture inflammatory chemicals called prostaglandins. Ibuprofen, naproxen, and prescription anti-inflammatories all work by blocking this exact pathway. Castor oil does something chemically similar, just without the stomach lining damage as a bonus gift. When absorbed through skin near a joint, ricinoleic acid suppresses local prostaglandin production. Swelling signals get quieter. Fluid accumulation inside the joint decreases. Pain receptors have significantly less to scream about. A study in phytotherapy research put castor oil head-to-head against diclofenac gel in knee osteoarthritis patients. Castor oil matched it in reducing both pain and morning stiffness. Applying it before bed creates an uninterrupted window. No walking, no weight bearing, just hours of direct anti-inflammatory contact with tissue that desperately needs a break. Your joints are basically begging you to stop ignoring them. Your gut wakes up actually working. Nothing says good morning like your digestive system finally deciding to participate in society after 3 days of silent protest. Ancient Egyptians used castor oil to get things moving. Your grandma threatened you with it. Turns out they were both onto something your gastroenterologist charges $400 to tell you. When ingested in small amounts, ricinoleic acid binds to EP3 receptors lining your intestinal walls. Those receptors trigger smooth muscle contractions, and your intestines are essentially one long muscular tube that needs to squeeze rhythmically to push everything through. Castor oil tells it to stop being lazy. But even topical application over the abdomen reaches deeper than most people expect. Ricinoleic acid penetrates far enough to influence the enteric nervous system, the dense nerve network wrapped around your digestive tract that scientists actually call your second brain. This keeps peristalsis active instead of grinding to a halt during sleep. Bloating deflates. Stagnant digestion gets unstuck. People who use abdominal castor oil packs consistently report more predictable morning bathroom habits, which sounds unglamorous until you've spent a week wishing you had them. Your gut doing its actual job is wildly underrated. Hair follicles get a midnight power surge. Rubbing thick, viscous oil onto your scalp and then laying your head on a pillowcase is a completely reasonable thing adults do now. Your pillow may never forgive you. Your hair follicles, however, are absolutely thriving. Hair growth happens in cycles: active growth, resting, shedding, and the most productive phase runs while you sleep, when your body releases growth hormone and redirects resources toward repair. Ricinoleic acid amplifies this by dilating small scalp capillaries, flooding each follicle with extra oxygen and nutrients right when the growth cycle needs them most. It also mildly inhibits prostaglandin D2, a chemical directly linked to follicle miniaturization in pattern hair loss. By keeping that signal suppressed, follicles stay in their active growth phase longer instead of prematurely tapping out. The thick consistency creates a seal over both scalp and existing hair shafts, locking in moisture for hours. Less moisture loss means less morning breakage, fewer split ends, and strands that actually have structural integrity. Follicles that spend 8 hours well-fed and hydrated produce stronger hair over time. Your pillowcase is a small price to pay. Castor oil declares war on bacteria. Your face is covered in millions of bacteria right now. Before you spiral, most of them are fine, actually helpful. But a select group of microbial freeloaders spend their nights multiplying in your pores, causing acne, odor, and skin breakdown while you sleep, completely unaware. Rude. Ricinoleic acid is a clinically documented antimicrobial. Studies confirm it dismantles the cell membranes of Staphylococcus aureus and Streptococcus species, two of the most common skin troublemakers. It also targets Candida albicans, the yeast behind persistent skin and nail fungal infections that refuse to quit. The mechanism is mechanical rather than chemical. Ricinoleic acid inserts itself directly into microbial cell walls and destabilizes their structural integrity. The bacteria lose the ability to hold themselves together. It's less antibiotic and more microscopic demolition crew. Left on skin for hours, castor oil meaningfully reduces harmful microbial populations without disturbing the beneficial bacteria that regulate your skin's pH and immune barrier. You wake up with fewer breakouts, less irritation, and a skin microbiome that actually resembles a functional ecosystem instead of a bacterial free-for-all. Your fascia stops being a nightmare. Fascia is the connective tissue wrapped around every muscle, organ, and bone in your body. And when it tightens up, it creates that deep, vague, impossible-to-explain ache that makes you walk like a haunted scarecrow every morning. Your chiropractor has a boat payment because of it. Ricinoleic acid penetrates into fascial layers and acts as a natural emollient, softening the dense collagen fibers packed inside. Healthy fascia fibers slide past each other smoothly. Dehydrated, stiff fibers fuse together into adhesions, sticky patches that restrict movement and radiate pain in directions that make no anatomical sense. Heat accelerates everything. A warm castor oil pack applied over a tight area before bed opens local capillaries, letting ricinoleic acid travel deeper into tissue than it reaches at room temperature. Once there, it hydrates collagen fibers and begins breaking down those adhesions at the microscopic level. With no movement loading the area, fascia stays in uninterrupted contact with the oil for hours. Stuck layers begin separating. You wake up with a range of motion that makes you briefly wonder if someone replaced your body while you slept. Turns out bean oil has strong opinions about your connective tissue. Fungal infections, pick the wrong fight. Toenail fungus is one of those problems people quietly tolerate for years because treating it feels awkward to discuss, and prescription antifungals come with a side of potential liver damage. So instead, everyone just wears socks at the pool and hopes nobody notices. There's a better option. Ricinoleic acid carries documented antifungal activity against Candida albicans and dermatophytes, the fungal species responsible for nail infections, athlete's foot, and stubborn skin rashes that cycle back every few months like an unwanted subscription. The mechanism targets fungal cell membranes directly. Fungal cells rely on a compound called ergosterol to maintain their membrane structure, essentially their version of cholesterol. Ricinoleic acid disrupts ergosterol synthesis, causing the membrane to lose integrity and the cell to collapse from the inside out. Fungal organisms thrive in warm, dark, enclosed environments, exactly what your socks create all day. Applying castor oil at night without coverings deprives them of that protected environment, while simultaneously dismantling their cellular structure. Consistent nightly treatment starves the infection of both the conditions and the membrane integrity it needs to survive. Fungi pick the wrong body. Your liver gets a nudge it didn't ask for. Your liver performs over 500 functions daily, filters roughly 1.5 liters of blood per minute, and gets absolutely zero appreciation until someone orders a round of tequila shots and everything goes sideways. Meanwhile, it's been quietly overwhelmed since approximately 2019. Castor oil packs placed over the upper right abdomen, directly over the liver, have been used in naturopathic medicine for decades. The mechanism centers on ricinoleic acid, stimulating bile production and flow. Bile is the digestive fluid your liver manufactures and your gallbladder stores, responsible for breaking down dietary fats and escorting fat-soluble toxins out through the digestive tract. When bile flow stagnates, a condition called biliary stasis, toxins recirculate instead of getting eliminated. Ricinoleic acid's prostaglandin receptor activation encourages smoother bile duct contractions, keeping that exit pathway clear and functional. Slapping a castor oil pack on before bed hands your liver its longest uninterrupted support window of the entire day. No new food incoming, no alcohol to neutralize, no medications demanding processing power. Just hours of sustained contact nudging bile production and lymphatic drainage simultaneously. Not a detox miracle, just giving an overworked organ slightly better working conditions for once. Your skin repairs itself at an unreasonable speed. Cuts, scrapes, and surgical incisions just sitting there healing at whatever pace they feel like is so last century. Your skin has an entire repair system built in, and most people spend zero effort optimizing it, then wonder why a paper cut is still visible 3 weeks later. Ricinoleic acid accelerates wound healing through two distinct pathways. First, it creates a semi-occlusive barrier over damaged skin, sealing the wound enough to retain moisture without completely cutting off oxygen. Moist wounds heal significantly faster because skin cells called keratinocytes migrate across wet surfaces far more efficiently than dry, scabbed tissue. Second, ricinoleic acid actively stimulates fibroblast activity. Fibroblasts are the cells responsible for producing new collagen, the structural protein that rebuilds skin from the inside out. More fibroblast activity means denser, stronger tissue replacing the damaged area faster. Applying castor oil to healing skin before bed capitalizes on your body's natural nocturnal repair cycle, when growth hormone peaks and cellular regeneration runs at full capacity. The combination of hormonal repair signals and ricinoleic acid's fibroblast stimulation rebuilds tissue faster than either would alone. Scarring also decreases because new collagen lays down more evenly when moisture levels stay consistent through the night. Your nervous system finally shuts up. Your nervous system has two modes: fight or flight and rest and digest. Most people in 2026 are permanently stuck in the first one, running on cortisol and caffeine, wondering why they can't sleep despite being exhausted enough to cry at a paper towel commercial. Castor oil applied to skin stimulates cutaneous nerve endings just beneath the surface. Those nerves feed directly into the vagus nerve, the massive neural highway connecting your brain to your heart, lungs, and digestive organs. Vagus nerve activation is the biological switch that shifts your body from sympathetic overdrive into parasympathetic recovery mode. Ricinoleic acid's anti-inflammatory properties also reduce neuroinflammation, low-grade inflammation affecting nerve tissue that contributes to anxiety, poor sleep quality, and that wired but exhausted feeling that's become disturbingly normal. Calmer nerve tissue fires less erratically, making it physically easier for your brain to power down. Abdominal castor oil packs show measurable increases in parasympathetic tone within 20 minutes of application in clinical observations. Heart rate drops slightly, digestion activates, muscle tension releases. Used consistently before bed, your nervous system stops treating sleep like a threat and starts treating it like the biological necessity it actually is. Turns out your stress response didn't need another supplement, it needed a bean. Your body runs a full overnight maintenance shift whether you help it or not. Castor oil just gives it better tools to work with. Every single mechanism covered here is backed by real biochemistry, not wellness folklore your aunt forwards in group texts. If your joints, skin, gut, or nervous system could use a night shift upgrade, hit subscribe, because we're just getting started.